Good evening. This is All India Radio. I'm Manoj Singh Rana, and with me is R.S. Raghu with the evening news. The headlines. Defence Minister Rajnath Singh reiterates that armed forces should provide all necessary assistance to civilian administration. 7 Indian naval ships deployed for shipment of liquid medical oxygen-filled cryogenic containers and medical equipment from various countries. COVID-19 vaccination drive for the age of 18 years and above begins. Over 2.66 crore people register on CoWIN portal so far. Over 15 crore 49 lakh doses of COVID-19 vaccine administered in the country so far. First batch of Russian COVID-19 vaccine Sputnik V arrives in India. More than 2,99,000 people recovered from COVID in last 24 hours in the country. Lockdown in the national capital extended by 1 week. All arrangements in place for counting of votes for assembly elections in 4 states and 1 union territory tomorrow. Government extends timelines of certain compliances by taxpayers in view of pandemic. And in IPL cricket, Mumbai Indians take on Chennai Super Kings in Delhi. As the number of COVID cases is on the rise, we appeal to our listeners to take all precautions and all those above 18 years of age to get vaccinated without any hesitation. Vaccination for the person of age between 18 and 44 begins today at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. Now the news in detail. Defence Minister Rajnath Singh has reiterated that the armed forces should provide all necessary assistance to civilian administration and asked the officials of the Defence Ministry and the 3 services to closely monitor the progress of various initiatives. Mr. Singh today reviewed the efforts and preparedness of the armed forces and the Ministry of Defence in strengthening India's fight against the COVID-19 pandemic through video conferencing. Mr. Singh was briefed that approximately 600 additional doctors are being mobilized through special measures such as calling those to duty who had retired in the last few years. The Indian Navy has deployed 200 battlefield nursing assistants to assist in various hospitals. The National Cadet Corps, NCC, has deployed 300 cadets and staff at various locations in Maharashtra, Uttarakhand and Haryana. A telemedicine services to be operated by health veterans will begin soon to provide consultation to those patients who remain at home. The Indian Army has made available more than 720 beds for civilians in various states. The Defence Minister directed the Army to share the details with local administration at the state and district levels. Chief of Defence Staff, General Bipin Rawat, suggested that local military commands have to be actively engaged in assisting the civil administration. Mr. Singh was briefed that the 500-bed hospital being set up at the DRDO in Lucknow will start functioning in the next 2 to 3 days. Another hospital is also being set up in Varanasi, which is scheduled to be completed by the 5th of this month. DRDO Chairman Dr. G. Satish Reddy said the first 4 out of 380 oxygen pressure swing adsorption PSA plants being manufactured under the PM CARES Fund will be deployed in hospitals in New Delhi by next week. Mr. Singh appreciated the logistic support being provided by the armed forces in transporting oxygen containers from abroad as well as within the country between places of consumption and production. As of today, the IAF carried out 28 sorties from abroad, airlifting 47 oxygen containers with 830 metric tons of capacity, while from within the country, it carried out 158 sorties, airlifting 109 containers with 2,271 metric tons capacity. The Navy and the Air Force have also supplied nearly 500 portable oxygen cylinders from their stores to various civilian hospitals. Defence public sector undertakings are procuring 28 oxygen plants and other medical equipment worth 40 crore rupees under corporate social responsibility for supplying to various hospitals in different states. The Hindustan Aeronautics Limited has set up a 250-bed hospital in Bengaluru. Another 250-bed is being set up in Lucknow.
In support of the nation's fight against COVID-19 and as part of Operation Samudra Setu 2, 7 Indian naval ships including Kolkata, Kochi, Talwar, Tabar, Trikand, Jalashwa and Airavat have been deployed for shipment of liquid medical oxygen-filled cryogenic containers and associated medical equipment from various countries. INS Kolkata and INS Talwar mission deployed in Persian Gulf were the first batch of ships that were immediately diverted for the task and entered port of Manama, Bahrain on 30th of April this year. INS Talwar, with 40 metric ton liquid medical oxygen, has commenced its journey back to India. INS Kolkata has proceeded to Doha, Qatar for embarking medical supplies and will subsequently head to Kuwait for embarking liquid oxygen tanks. In the first phase of Operation Samudra Setu, which was launched last year by the Navy, around 4,000 Indian citizens stranded in neighbouring countries amidst COVID-19 outbreak were successfully repatriated to India. The liberalized and accelerated Phase 3 of the COVID-19 vaccination drive has started today. Everyone above the age of 18 years will be administered the COVID-19 vaccine in this phase. The registration process for this phase is on and over 2.66 crore people have registered themselves on the CoWIN portal so far. The appointments for people aged 18 years and above has also opened at multiple locations. In this phase, the vaccination will continue as before in the central government's vaccination centres free of cost to the eligible people, including healthcare workers, frontline workers and all people above 45 years of age.
The world's largest COVID-19 vaccination drive is progressing smoothly in the country. The Health Ministry has informed that over 27,44,000 doses of COVID-19 vaccines were administered to the beneficiaries in the last 24 hours. The ministry said over 15 crore 49 lakh people have already been inoculated with COVID-19 vaccines in the country so far. The centre has so far provided nearly 16 crore 37 lakh COVID vaccine doses to states and union territories free of cost. Of them, the total consumption, including wastages, stood at over 15 crore 58 lakh doses. The Union Health Ministry in a statement said that more than 79 lakh COVID vaccine doses are still available with the states and UTs to be administered. Over 17 lakh vaccine doses will be received in addition by the states within the next 3 days. As per the data of the Health Ministry, Maharashtra has so far received over 1 crore 63 lakh doses of vaccine and the total consumption including wastage is around 1 crore 62 lakh. Uttar Pradesh was provided over 1 crore 36 lakh doses and the consumption including wastage in the state is nearly 1 crore 33 lakh.
India has said that the arrival of the Russian COVID vaccine Sputnik V will further augment country's vaccine capacity and will also accelerate its vaccination drive. Spokesperson in the Ministry of External Affairs, Arindam Bagchi, has said that the Russian vaccine will add to the country's arsenal to fight out the pandemic. He informed that 150,000 doses of the vaccine have been received in today's consignment. Mr. Bagchi added that other larger consignments will also arrive soon. Highlighting more than a decade-long India-Russia special and privileged strategic partnership, the spokesperson also informed of the plans to manufacture the Russian vaccine in the country on large scales. Russia's ambassador to India, Nikolay Kudashev, expressed happiness on the arrival of first batch of Russian COVID vaccine Sputnik V in India today. In his message, the ambassador said that as both Russia and India continue dedicated joint efforts to combat the COVID-19 pandemic, the arrival of Sputnik V is important to support India's endeavours to mitigate the second wave of COVID and save lives. Mr. Kudashev asserted that the efficacy of Sputnik vaccine is among the highest in the world and will also be effective against new strains of COVID-19. He informed that its local production in India will commence soon and is planned to be gradually increased up to 850 million doses per year.
The number of active cases of COVID-19 in India continues to rise and presently comprises nearly 17.06% of the total reported cases. In the last 24 hours, the nation registered a total of 4,01,993 new COVID cases and over 2,99,000 people have recovered So far, over 1,56 lakh people have recovered from COVID-19 infection in the country. With this, the recovery rate has further slipped to stand at 81.84%. The Health Ministry has informed that over 32,68,000 people are suffering from COVID and are either hospitalized or under home isolation. According to the ICMR, more than 19,45,000 samples were tested in the country in the past 24 hours. Delhi Chief Minister Arvind Kejriwal today announced that lockdown in the national capital is being extended by 1 week. On the 19th of last month, the Delhi government has decided to put the city under a week-long lockdown, which was later extended till the 3rd of May.
अभी भी कोरोना का कहर जारी है और कोरोना कम नहीं हो रहा, तो इसीलिए उसके मद्देनजर कई लोगों के भी जनता के बीच में भी जब हम लोगों ने बात करने की कोशिश की, सबका मत यही है कि लॉकडाउन को भी और बढ़ाना चाहिए। तो लॉकडाउन को दिल्ली के अंदर 1 हफ्ते के लिए और बढ़ाया जा रहा है, अगले सोमवार को सुबह 5 बजे तक के लिए।
Amid the rise in COVID cases in the country, positive news is coming from Uttar Pradesh, where positivity rate of COVID patients is on a downward path. In the state, total number of recovered patients in last 24 hours is much higher than the new infected people. More than 38,000 patients recovered yesterday in the state, while around 30,000 new cases of COVID infection were reported in the last 24 hours. This comes despite the fact that the state has increased the number of COVID tests from last few days, and yesterday around 2,66,000 COVID tests were conducted. Situation is quite heartening in the state capital Lucknow, which was epicenter of the pandemic few weeks back. The number of recovered patients in Lucknow is almost double than the number of new COVID patients. In the last 24 hours, around 6,100 patients have recovered from the infection in the state capital, while around 3,100 new cases have been found in the last 24 hours. Same is the situation of top 7 cities in terms of COVID patients. In cities like Kanpur, Gorakhpur, Meerut, Gautam Buddha Nagar, Varanasi and Prayagraj, the number of recovered patients is higher than the number of new found patients. Tamil Nadu registered nearly 20,000 fresh COVID cases today. In Chennai alone, the count nears 6,000 cases. More than 17,000 people have been discharged and over 600 children below 12 years of age have been affected. The state reported 147 deaths today. 1,51,000 tests have been done so far in the state. More from our Chennai correspondent.
The Public Health Department has announced that vaccination camps would function tomorrow for those above 45 years of age despite Sunday curfew and counting of votes. The Greater Chennai Corporation Commissioner G. Prakash asserted that of the 60 to 70,000 frontline workers in the city who had been vaccinated, currently only 619 had contracted the infection. The Commissioner stated that no employee had died in the second wave. The Commissioner affirmed that the main reason for such a reduced mortality and infection in the second wave was due to vaccination. He also told that 150 journalists who had taken the RT-PCR test to cover the counting activities, only one had tested positive. This was also highlighted as a success for the vaccination drive. Joy, AIR News, Chennai.
Kerala continues to report surge in COVID cases as it confirmed 35,636 new COVID positive cases today. The test positivity rate is at 24.33%. 15,493 recoveries were also reported today. 48 deaths were also confirmed due to COVID today, taking the death toll to 5,356 in the state. At present, 3,23,828 people are undergoing COVID treatment in Kerala. While briefing the media, Chief Minister Pinarayi Vijayan stressed the importance of the active participation of local bodies to curb the COVID spread. The CM further said that discussions are continuing with the vaccine manufacturers and all measures will be taken to make the vaccine accessible to the public soon.
In Sikkim, 259 people today tested positive for COVID-19 infection. A total of 1,174 cases have been recorded this week. With this, the total number of affected people so far has reached 8,031 in the state. Out of them, 6,236 people have recovered, while the total number of active cases is 1,647. Our Gangtok correspondent reports that one infected person died today, taking the COVID death toll to 148 in the state.
Of the new 259 COVID-19 infections, East Sikkim district reported 195, taking total cases to 6,241. South Sikkim reported 32 new cases with a total of 1,211 cases, while West Sikkim reported 22 new cases with a total of 462 cases. North Sikkim recorded 10 new cases, taking the district tally to 117 cases. New 41 recoveries were also recorded in the state in the last 24 hours. With Sankat Sarkar and Pankaj Dhungel, Pajat Sharma from Gangtok for AIR.
Leh is observing weekend COVID curfew since Friday 9 p.m. Amid rising number of cases in the district, the Leh Disaster Management Authority has announced COVID curfew for this weekend across the district. The Leh district has 1,450 active positive cases as of today. Essential and emergency services are allowed during the restrictions in the Leh district. Leh DDMA Chairman Shrikant Suse, along with Leh SP Stenzen Nurbu, have inspected the implementation of curfew at various places. Shrikant Suse said the district administration has made all arrangements to ensure that people do not face any inconvenience during the weekend COVID curfew.
कोविड कर्फ्यू इम्पोज किया, इमरजेंसी सर्विसेज को अलाउड किया। जो हमारे टूरिस्ट है जो एयरपोर्ट से जा रहे हैं या एयरपोर्ट से आ रहे हैं उनकी मूवमेंट को भी फैसिलिटेट किया जा रहा है। और इसेंशियल सप्लाईज को लेके जो व्हीकल्स हमारी दो जिला से आ रही है और पैसेंजर्स भी आ रहे हैं तो उनका भी हमने स्क्रीनिंग मैकेनिज्म खलसी में रखा है पैसेंजर्स के लिए। और जो इसेंशियल सप्लाईज के ट्रक्स टैंकर्स हो गए उनके लिए हमने सियांग में एक एडिशनल स्क्रीनिंग सेंटर अभी हमने मैं और एसपी साहब ने जाके वहाँ के अरेंजमेंट का रिव्यू किया। वहाँ उनका स्क्रीनिंग होगा, अगर कोई पॉजिटिव आता है तो उनके लिए अलग से हमने कोविड केयर सेंटर वहाँ सियांग में इस्टेब्लिश किया है।
In the Union Territory of Jammu and Kashmir, the administration of Government Medical College Hospital, GMC Jammu, has decided to suspend OPD services, including in its associated hospitals, in view of increased COVID patient load. AIR Jammu correspondent reports that the routine OPDs in GMC and its associated hospitals shall remain suspended from the 3rd of May till further orders. However, in order to avoid inconvenience to general public, the emergency services shall continue to remain functional 24/7 as per routine. In the Union Territory of Jammu and Kashmir, the Jammu Police has taken stringent measures for the implementation of COVID-19 guidelines. AIR Jammu correspondent reports that in a drive against the violators of the law, a massive action has been taken by the Jammu Police, in which several different FIRs are registered against the violators of the District Magistrate's order.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Defence Minister Rajnath Singh reiterates that armed forces should provide all necessary assistance to civilian administration. 7 Indian naval ships deployed for shipment of liquid medical oxygen-filled cryogenic containers and medical equipment from various countries. COVID-19 vaccination drive for the age of 18 years and above begins. Over 2.66 crore people registered on CoWIN portal so far. Over 15 crore 49 lakh doses of COVID-19 vaccine administered in the country so far. First batch of Russian COVID-19 vaccine Sputnik V arrives in India. More than 2,99,000 people recovered from COVID in the last 24 hours in the country. Lockdown in the national capital extended by 1 week. All arrangements in place for counting of votes for assembly elections in the 4 states and 1 union territory tomorrow. Government extends timelines of certain compliances by taxpayers in view of pandemic. And in IPL cricket, Mumbai Indians take on Chennai Super Kings in Delhi. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the evening news. Chief Election Commissioner Sushil Chandra today reviewed the counting arrangements of 4 states and 1 union territory through a virtual meeting. Mr. Chandra directed that all laid down instructions of the commissions must be strictly adhered to and all counting halls must be fully COVID guidelines compliant. Counting in 4 poll-gone states of Assam, Kerala, Tamil Nadu and West Bengal with 1 union territory of Puducherry and for by-polls held in other constituencies will begin at 8 a.m. tomorrow morning. The Election Commission has made elaborate arrangements for smooth and safe counting in 822 assembly constituencies in the 5 poll-gone states and union territory, along with for counting of the by-polls held in 4 parliamentary constituencies and 13 assembly constituencies across 13 states. All arrangements are in place for counting of votes for assembly elections in West Bengal tomorrow. Out of 294 assembly seats, polling was held in 292 seats in 8 phases, while in 2 seats in Murshidabad, polling will be held on the 16th of this month. In the wake of the rise in corona cases, the counting will take place under strict COVID guidelines set by the ECI. A report from our Kolkata correspondent.
In West Bengal, counting of 292 assembly seats will take place tomorrow. Arrangement for counting of votes has been made at 108 counting centres across 23 districts. Out of 108, 6 counting centres are in Kolkata, where counting of votes for the 2 electoral districts, Kolkata North and Kolkata South, will be done. Central forces will be deployed outside each counting venue. As the number of COVID cases have been on the rise constantly throughout the state, maintaining proper hygiene and safe distancing were given priority, and number of halls and tables have almost been doubled. There were 385 halls in 2016, while this time counting will be done at 706 halls. Rapid antigen tests have been going on since yesterday for everyone who will enter the counting venues. All the counting centres will be sanitized at regular intervals tomorrow along with EVM and VVPATs. Madhuparna Dharshoduri for AIR News, Kolkata.
The government has extended the timelines of certain compliances by taxpayers in view of the pandemic. The Ministry of Finance in a statement said that an appeal to Commissioner Appeals of Income Tax Act for which the last date of filing is 1st of April 2021 or thereafter is now extended and may be filed by 31st of this month. Besides, objections to Dispute Resolution Panel for which the last date of filing is 1st of April is also extended and can also be filed by 31st of May 2021. The ministry said the income tax returns in response to notice can be filed within the timeline allowed under the notice or by 31st of this month. In addition to it, filing of belated return and revised return for assessment year 2020-21, which was required to be filed on or before 31st of March, may be filed on or before 31st of May this year. The ministry further added that payment of tax deducted and filing of challan cum statement for such tax deducted which are required to be paid and furnished by 30th of April may be paid and furnished on or before the end of this month. The Railway Ministry has said that Oxygen Express will deliver a record 250 tons of liquid medical oxygen to Delhi, Telangana and Uttar Pradesh by tomorrow. Accelerating its pace of delivering liquid medical oxygen to various states, the Indian Railways has delivered more than 813 tons of liquid medical oxygen in 56 tankers to various states across the country. According to the Railways, 174 tons of liquid medical oxygen have been delivered to Maharashtra, more than 356 tons to Uttar Pradesh, over 134 tons to Madhya Pradesh, more than 79 tons to Haryana and 70 tons to Delhi. The ministry said 14 oxygen expresses have already completed their journey and 5 more loaded oxygen expresses are on the run carrying 342 tons of oxygen. Delhi is set to receive its second oxygen express with 120 tons of liquid oxygen by tomorrow evening. Telangana will also receive its first oxygen express currently on the way from Angul carrying over 124 tons of liquid medical oxygen. The ministry said Haryana received its first and second oxygen express today carrying 79 tons of oxygen in 5 tankers.
The Prime Minister's office, PMO, has asked the Health Ministry to allot 150 ventilators purchased from the PM Cares Fund to the Sardar Patel COVID Care Centre in Delhi. Bhaskar Khulbe, advisor to the Prime Minister, has written a letter to the Joint Secretary in the Health Ministry, Mandeep Bhandari, and asked to provide the ventilators embedded with GPS-enabled devices on loan basis for a period of 6 months, which can be extended further. He also requested to organize immediate installation of these ventilators by the selected vendors. Director General of the Indo-Tibetan Border Police, S.S. Deswal, had requested for the ventilators. The Sardar Patel COVID Care Centre, run by the ITBP and the Delhi government, was restarted with 500 oxygen beds on the 26th of last month.
The centre has enhanced supply of vital antiviral drug remdesivir to states. After issuing the revised supply plan today, Union Chemical and Fertilizers Minister Sadananda Gowda said that after in-depth review of enhanced availability of remdesivir due to its ramped-up production, the allocation plan has been revised. He affirmed that the increased supply of the vital drug will help in fighting pandemic with deeper resolve. Under the revised supply plan, the allocation for states like Delhi, Maharashtra, Chhattisgarh has been considerably enhanced. The centre has waived off the import duty on vital diagnostic kits and reagents used in COVID-19 related diagnosis for the next 6 months. The decision has been taken to supplement testing efforts. The exemption has been given till the 31st of October this year.
The Gross Goods and Services Tax GST revenue collected in the month of April is at record high of 1,41,384 crore rupees, of which CGST is 27,837 crore, SGST is 35,621 crore, IGST is 68,481 crore, and cess is 9,445 crore rupees. The Finance Ministry said the revenues for the month of April this year are 14% higher than the GST revenues in the month of March 2021. The Indian Coast Guard has rescued missing Tamil Nadu fishing boat Mercedes in a massive search operation launched since 24th of last month. With 11 crew, the fishing boat had sailed for deep sea fishing west of Kerala on the 6th of April for 30 days voyage from Chengapattanam fishing harbour in Tamil Nadu. The World Health Organization has given the go-ahead for emergency use of Moderna's COVID-19 vaccine. The mRNA vaccine from the US manufacturer joins vaccines from AstraZeneca, Pfizer-BioNTech and Johnson & Johnson in receiving the WHO's emergency use listing. In a statement, WHO's CEO Stephen Bancel said, similar approvals for China's Sinopharm and Sinovac vaccines are expected in the coming days and weeks. The green light for Moderna's vaccine, announced on date yesterday, took many months because of delays that the WHO faced in getting data from the manufacturer. Back home in Maharashtra, the phase 3rd of the vaccination drive, which began for the age group of 18 to 44 years, was held in 26 of the total 36 districts of the state. According to the State Health Department, 132 vaccination sessions were held throughout the day.
In IPL cricket, Chennai Super Kings were 138 for 4 in 15.2 overs against Mumbai Indians at Arun Jaitley Stadium in Delhi when reports last came in. Earlier, Mumbai Indians won the toss and elected to field. Yesterday, Punjab Kings defeated Royal Challengers Bangalore by 34 runs at Ahmedabad. Now let us take a look at the weather forecast for tomorrow. The national capital Delhi is likely to have thunderstorm with rain. The temperature will hover between 28 and 39 degrees Celsius. Mumbai will have generally cloudy sky with light rain or drizzle. Chennai is expected to have a partly cloudy sky. The temperature will vary between 28 and 35. Srinagar will have mainly clear sky, becoming partly cloudy towards afternoon or evening. Jammu will also have mainly clear sky, becoming partly cloudy towards the evening. Leh is expected to have partly cloudy sky. Gilgit will have mainly clear sky. The temperature will be between 10 and 33 degrees Celsius, and Muzaffarabad is also likely to have a mainly clear sky.
Now, before we end the bulletin, the headlines once again. Defence Minister Rajnath Singh reiterates that armed forces should provide all necessary assistance to civilian administration. 7 Indian naval ships deployed for shipment of liquid medical oxygen-filled cryogenic containers and medical equipment from various countries. COVID-19 vaccination drive for the age of 18 years and above begins. Over 2.66 crore people registered on CoWIN portal so far. Over 15 crore 49 lakh doses of COVID-19 vaccine administered in the country so far. First batch of Russian COVID-19 vaccine Sputnik V arrives in India. More than 2,99,000 people recovered from COVID in the last 24 hours in the country. Lockdown in the national capital extended by 1 week. All arrangements in place for counting of votes for assembly elections in 4 states and 1 union territory tomorrow. Government extends timelines of certain compliances by taxpayers in view of pandemic. And in IPL cricket, Mumbai Indians take on Chennai Super Kings in Delhi. For details of these stories and more, log on to our website, newsonair.com and News on AIR app. And with that, we end the evening news. Good night.